Hello everyone, I'm Dr. Anuj Pachhel. Welcome back to my second channel, Anuj Unscripted. And in this video, I'll be talking to you about all the things that you should be knowing before you get to your hospital. So it might be for anybody, right, from MBBS students to interns to BMS, BHMS students, nursing students, BPMT, whoever is working in the hospital for the first time. This is all the things that you should be knowing. This is the first part of the video where I'll be addressing all the general things that we are supposed to do, addressing our timing, the biomedical waste disposal, notes, calls, discharges, postings, joinings, completions, everything. So this is the part 1 in the series, and in the second part I'll be showing you exactly what are all the clinical skills that you should be doing with real life examples, and I'll be teaching you how to do different clinical procedures. You should definitely watch them till the end to increase your knowledge quite by a lot. It does not matter if from first year, second year, third year, final year ho. This is something all medicos should know, and if you don't, now is the time to improve upon. Without any further ado, let's start. Before we go ahead, please make sure to subscribe the channel as I'm trying to provide valuable content over here. First things first, hospital is not a place that you should be taking lightly. It's a place full of so many people that are with pain and with suffering. So you should always go to the hospital with the feeling and the intent that I'm going to go over there and do some good. If you have that feeling inside you, you will always try to do best with the patient. Now let's talk about your posting timings. So a lot of different hospitals have different timings, but the common duty shifts are 6-6-12, 8-8-8 or 12-12. So what does that mean? 6-6-12 means it's a 24-hour shift in which you'll have 6 hours morning, 6 hours evening and a 12-hour night duty. So there are several postings. For example, you go to the surgery ward and they might tell you the duty timing is 6-6-12. That means subah ke 6 ghante, that is 8 to 2, then we have got 2 to 8 and then got 8 to 8. So that is a very common practice that we have in our hospital at GMC Nagpur. 6-6-12 duties hoti hai. Another one is 8-8-8, so 8 to 4, 4 to 12 and 12 to 8. That is the 8 hours rotation. Other is 12-12. So 8 to 8 and 8 to 8. That is the basic posting timings. You can have varying timings depending on your specialty as well as depending on your particular hospital. One thing which is stated in our NMC guidelines is that interns are not supposed to be working in the evenings. So if somebody is calling you for an evening round, if they are requesting, you can go, but it's not official, it's not something mandatory, okay? And if they are giving you extension because of that, you can take it up with the NMC. So that is one thing that you should be knowing. Interns are supposed to do night duties in certain departments, but that are also regulated, and evening duties are not a part. So if you see bigger colleges, higher colleges, their evening duties do not exist, but especially a lot of state colleges, we have such that we also go in the morning plus we go in the evening. So we've got different rounds, morning round and evening round, and then we have to do the work of whatever the senior consultants have told us to do. So that is the basic idea about your posting and timings. So with respect to timings, with especially in ICUs, you have to be thorough. That means if you're specially posted in like medicine ICU, surgery ICU, pediatric ICU, there one person will not go unless the other person arrives. For example, let's say I'm doing a night shift from 8 to 8. So in the morning 8, I can leave, but I actually can't because nobody is there to replace me. So whenever my replacement intern comes, only then am I supposed to leave. So if that intern comes 1 hour late, I'll have to sit there for 1 hour. I just can't go because ICUs mein emergencies are very, very common and you have to be ready to treat those emergencies. I have seen cardiac arrests that are happening in the ICUs that I'm posted in. So you have to be ready to handle those emergencies, right? When you are supposed to leave, kuch na kuch ho sakta hai, and that's why whenever the person comes there to replace you, only then you are supposed to go ahead. In the wards especially, you can, if it's a 6-6-12 duty, morning ke 6 hours mein, you can cheese it by going to 9 or 9:30 or even 10 in some wards. It does not matter, as long as you're doing your job, as long as you're doing all the things that your JR or your seniors have told you to do, you can pretty much leave after that's done. Now some JRs will be like, no, you have to stay till 2. If they are adamant, then you just have to stay. We can't do anything about such people. Such people sadly do exist in our system, but most of the JRs or most of the people that you're going to be encountering will let you go if your job is completed. If your job is done, nothing is left. So yeah, that was all about posting and timings. Now there's one thing called as handover. Now what does this handover mean? For example, there are 20 beds, okay? Bed number 1 में Foley's change करना है, bed number 2 में तुमको ये sampling करनी है, bed number 3 में कुछ और करना है, ऐसे करके there are 20 beds. So you have list of tasks and you complete some of them are left. For some of the other reason you could not complete. Now the person who is supposed to replace you comes over and then you have to give them this handover. You have to tell, okay, out of this list, I have done so many things. You have to continue and do the remaining things which are left. Plus you have to inform the team about what is going on. That means the patient is doing well or not, the vitals vitals, how are they looking, what are the sort of drugs which you have given them, and how is the patient overall. So that is called as handover. It takes quite a lot of time. It might take 30 minutes, 20 minutes, it might sometimes take 2 hours. So it depends on what is the unit that you're placed in, and if it's a heavy unit, then handover is going to take a lot of time. This is very important, especially if you're in a nursing job. So nurses have to have a very good handover, because you don't want to repeat the doses which are already given. You need to maintain adequate charting. So that is only happening when handover is done good. So yes, that's about the handover, which is a medical term. So if somebody tells you कि okay, इसको handover दे दो, फिर चले जाओ, you know now what to do. The next thing is joinings and completions. So anytime you go in a department, they'll be like, joining de di kya? So what does that mean? So joining is a letter ki okay, I am this intern, I have joined this department from this date, and you just have to submit it into the office, or you can keep it with yourself depending on what type of hospital and what type of department you are posted in. And that is basically what joining is. It proves that you have joined that unit. So for interns especially, every time make sure that you take your joining in time. I have done on the entirety of internship almost, just 4 weeks are left. So I have made sure that I've got all the joinings. The reason is, if you have a joining, that means that it proves that you had joined. Now let's say that you were on a 3-week break and you come back for doing the last 1 week, okay, and then in 1 week you do extraordinary job, and then you take the completion, okay. So they might say कि okay, चलो छोड़ो, 3 हफ्ते इसने नहीं किया, कोई बात नहीं, but 1 हफ्ता तो किया है, let's give him the completion. So that's how it works. If you have the joining, if you have the completion, that just on paper states that you have been there in that unit for that amount of time. So 4 weeks, let's say you have been there, even if you are absent for 3 weeks for, let's say, some particular reason. So having a joining is very essential. It just proves कि तुम वहाँ पे थे, उसमें लोग sign करते हैं, they write this person has joined from this date. So joinings and completions, make sure you take a record of this. For completions, have not been that active. We have got to go completion hunting for so many different things which you have placed in. But since you have already got the joining, it won't be a bigger hassle. So you just take the copy of joining and completion letters at the beginning of internship. 25-26 copies print करा लो, because roughly उतने ही departments में तुमको जाना होता है. And as you progress, you'll have to give out some joinings and completions to your batchmates who have forgotten. So that's next thing. Is point number 3 I want to talk about is, you should dress appropriately whenever you're going to the hospital. Again, it's not a place where you should be filming reels or TikToks or whatever. Especially make sure that you keep the sensitivity of the patients who are present in the hospital into your mind whenever you're doing some filming or shooting, whatever it is that you're doing. Recently, students in South India were sort of suspended from their college, and I think that's pretty appropriate. I might be too harsh to saying that, but working in a hospital is not something like you should be very mindful of that surrounding, because I don't know how many hospitals you have been to, but I have been to quite a lot of hospitals. My relatives have gotten quite sicker, some of them have passed away, and I really know like what it feels to be a relative as well as what it feels to be a doctor when we are inside the hospital. So please be mindful of your surrounding. आपका दिन बहुत अच्छा जा रहा होगा, but somebody else, very loved one, might have passed away. So please be mindful. That's all I want to say. Dress appropriately. Formals are appreciated, but if you can't wear formals, that's all right, okay, but dress appropriately. Please make sure to take a note. Shoes are mandatory. The reason is, I'll tell you, whenever you're doing sampling or whenever you're doing anything, there can be blood spillage. Cuts लग सकते हैं, कुछ भी हो सकता है patient का, and that blood will directly fall to your feet. Sometimes you might drop a scalpel and that might just injure your tendon. So don't do that. If you're wearing shoes, it just takes 2 minutes. I know everybody wears Crocs. I have never bought a pair of Crocs myself, but I do like them from time to time. मेरे दोस्त लोग कभी पहन लिया तो. But shoes are very essential. Shoes protect your feet. There was this one time I was wearing scrubs and I went to do a procedure. It was an ICD and I made the incision. Of course, there was some blood, hemothorax था. तो उसके बाद उसका थोड़ा बहुत खून मेरे पैर पे गिरा था, and I had to just wash that very thoroughly. So don't do the mistakes which I make. Wear shoes, and after that I always started wearing shoes. Dress appropriately, wear shoes, compulsory. Look good, and always you have a stethoscope on you to tell that you're a doctor, plus you'll use your stethoscope every single time whenever you're in the hospital. Now next thing, very important, speaking about this entire incident, personal protection is a must. This is my 4th point. That means that whenever you're dealing with anything related to patients, make sure that you're protecting yourself. That means if it's a patient who has got universal precaution sign on their bed. Universal precaution means the patient is either retropositive, that is HIV positive, or they can have HBsAg, that is what we call hepatitis B, or they can have hepatitis C or any other blood transmissible disease. So we put up a universal precaution sign on their entire bed, so that whenever whoever is working, they know that what they are dealing with. So personal protection is an absolute must. Whenever you see a patient like this, always wear double gloves. That means एक gloves पहनो, फिर उसके ऊपर एक और gloves पहनो, same on their 2 hands. You do not want to get pricked by especially all these infected people, because it's very easy, the viruses transfer very fast. So HBC has a rate of 30%, HBsAg has a rate of 3%, and HIV has a rate of 0.3% for every needle stick injury of transmissibility. So it's very high, it's very contagious. Personal protection is an absolute must. Another thing I want to know, don't really bother about how many gloves you are spending in one day. So especially in high output centers, you might end up using the entire glove box in one night. So that frequently happens, because every time that you are going to a different patient, you have to switch the gloves, because you can't touch the bloody hands of one patient to the other patient. So you can discard as many gloves you want, you can wear as many gloves, especially if you are in a government setting, you should absolutely take the use of that. And whenever you're doing any sort of procedures, just wear gloves. It just reduces the incidence of so many bad things happening to you. Blood spillage हो रहा है, तुम्हारा hand बच जाएगा. Okay, urine spillage हो रहा है, जो कुछ भी तुम procedure कर रहे हो, if something inadvertently goes wrong, it is going to save you, most importantly. And so also gloves are sterile, so once you are wearing the gloves, the patient is also got very less chance of infection. For example, you are doing a Foley's catheterization and you feel like, okay, I want to wear gloves, so that reduces the chance that you are going to introduce some infection through the urethra into the bladder of the patient. That's why personal protection is a must. If you are working on COVID-19 units, thankfully there are not a lot of cases nowadays, but still, if you are working, there is an entire donning and doffing protocol which you must follow, and that is specially for part in ICUs. Now let's talk about biomedical waste disposal. So if you're working in any hospital which is well equipped, you will have dustbins which are of 4 types. Okay, so there will be the red dustbin, there will be the yellow dustbin, there will be a black one, and there will be a white sharps ka dabba, and also in orthopedics there will also be a blue one. So these are the 5 types of bins which are commonly present in hospitals, and I'll tell you exactly what you have to put in what one. Now the reason why it's important for you is, okay, chalo, environment is blah 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 whatever, but most importantly, if you put anything in any dustbin by mistake, and if somebody sees, okay, then they might complain you, and it's like chargeable for 10,000 rupees. So that's very bad. So certain interns in our college have gotten charged that amount and they had to pay that. So okay, it's okay, like you have to be very careful as to which dustbin you put your waste in. It's also very harmful for the environment. The waste that we generate in our hospital, they are very toxic, and they are not like normal waste. So, and you might have already read in microbiology in dustbins ka kya hota hai. So let's go step by step. So the yellow dustbin, it is for anything related to blood. That means if you have got gauzes which are soiled with blood, if you have got cotton pads which are soiled with bloods, so all of that things goes into the yellow one. If you got placenta after delivery, that goes in the yellow one. So animal anatomical waste, human anatomical waste, anything related to blood, it goes in the yellow bag. If it's got cytotoxic drugs, all of that are going to go into the yellow bag as well. Now the red bag, this is the bag which you're going to be using the most frequently. All sorts of gloves goes inside the red bag. Now the red bag, even if your gloves are soiled with blood, you have to put it in the red bag, because gloves are made of plastic, and all of this plastic things, anything related to plastic goes in the red bag. So right from your tubes, your Foleys, to your rails, to your everything that has got made of plastic, right, that has to go in red. Now let's talk about the next one, which is the black one. So that's the general dabba, जिसमें जो भी तुम wrapper है, let's say that you have taken a syringe and उसका wrapper है, that you have to throw in the black bag. Anything that is not that is basically a general waste. तुमने कुरकुरे खा लिया, उसका wrapper उधर फेंकना है. Whatever it is, glove का जो बाहर का wrapper होता है वो वहाँ पे फेंकना है. The syringes which you are using, that are going to go in the red bag, of course. The next one is the white sharps का एक box होता है. So it's a box made of plastic. It is an unpuncturable, puncture proof sort of box, and anything relating to sharp items, so from your blades to your scalpels to the needles which you will be using for sampling, to the intracath के जो अंदर के cannula होते हैं, so all of that will go into the white one. And the last one is blue one, so it's mainly for orthopedics, so all the implants and the broken ampule and the vials, they go into the blue ones. For usually they have a separate sort of collection system for ampules and also for vials, so depends on your hospital what sort of things you are using. Biomedical waste is very important. Always make sure to be protected and also protect the environment. So that's biomedical waste for you. Next, we have got this term called as notes. So what do you mean by notes? Whenever a patient is admitted into your ward, you have to keep a record, and that record is what we call notes. So notes include everything that you've given to the patient, the history of the patient, any significant complaints of the patient, what are the different reports that you have, what are the different samples that you've sent for investigation, what are the reports that you've attached, what is the treatment summary that is going on, how are the vitals of the patient doing, and all the calls that you've sent for the particular patient. So this is what encompasses the notes part. So there are different sorts of notes. Okay, Okay, so the first one is of course your OPD notes, that when patient comes to you, you write the entire name, you write the diagnosis, the clinical complaints, the history, etc., and then you come to the diagnosis, and then you write your own treatment, RX लिख के तुमको जो कुछ भी देना है तुम लिख दो, and then you sign it. So those are your OPD notes. If you feel like you have to admit this patient, write admit this patient in this unit, this ward, and then the person can go and print out an admission paper, and that's the admission paper. So you have to then repeat the same thing on the admission paper, and there you go, you can now admit the patient. So karte karte you will end up making a file which will basically tell you exactly why the patient was admitted, what all did you do, and what is the patient doing. In the end, you also write a complete discharge summary. So that is how it's done, and that is what we call notes. In notes part, you have to always remember that it is not the intern's job to do the notes, but in every college, interns will be doing the notes. I have done it, everybody has done it, but it's not your job. So let's say that you write something wrong, nobody's going to punish you, but they're going to punish your residents. So please be mindful that whatever you're writing it correctly. In the notes, you've also got to record the vitals of the patient. So any BP, pulse monitoring, SpO2, whatever you're doing, you have to record that and write it in a timing sequence. In ICU, that's usually like every hour you have to write the vitals. And in a ward setting, it's like 2 or 3 times a day. You have to take the vitals, like 6 hours apart, 8 hours apart. But that is something which you have to maintain. A lot of the people fake vitals, so don't fake vitals. At least जो सबसे significant वाले हैं, that is blood pressure, SpO2, pulse. You should take that. Temperature, I don't know. I've not done temperature that much, but these are certain vitals that you should be very mindful about. Especially RBS in infants. So RBS is random blood sugar. So you have to be very mindful that you are not putting anything fake. In any case, don't do anything fake. Nobody on camera says that people fake things, but everybody knows who has ever worked in a hospital that people do fake things. But we are telling you, so make sure to subscribe to the channel for more realistic tips. Next is something which you will commonly hear in hospital, that is call भेजा था मैंने. So an intern will come to you and they'll say to you, okay, sir, I've got a call from the ophthalmology department for a pre-anesthetic checkup for this patient undergoing cataract surgery. And now if you're an anesthesia intern, you'll just review that and just let them know to your seniors. And so that is what a call is. A call is basically whenever you are having a patient in your particular ward. Let's say that I'm working in a obs and gynae ward, and my patient has got something like dengue. Okay, so we have proven that it is dengue. So how do we then treat the patient? We are obs and gynae people. We are not supposed to treat dengue. We are supposed to manage everything else related to pregnancy. So now we'll call the medicine people and tell them, okay, there's this patient, she has dengue, and tell us what to do, and we'll follow your treatment protocol while keeping the patient in the ward. So how do you do that? You actually write a call, okay, dear sir, and this is the patient, she is having this, whatever the entire history, and then please kindly visit and check the patient once. Once you do that, somebody will go and take the call to the particular resident who is in medicine. The medicine people will see, okay, this is the patient, this is the entire file, this is the investigations I've done, and okay, now we'll come and see the patient and we'll tell you the treatment protocol. So now the medicine person will come and they'll give you, okay, you do all of this and let us know what happens next. So that's how it works. That's how the hospital works, because every specialty is different. Pediatrics people cannot treat maybe a surgical problem, or obs and gynae people cannot treat a medicine problem. Medicine people cannot treat a psychiatric issue, and a psychiatric issue cannot be solved by a dermat person. So that's how it is, that you have to call and you have to keep everybody in the hospital in check, and that's how it works. So that is what you mean by sending a call. You have to write a letter and you have to send it to a particular department. That department will help you review it and just follow up the patient after that. Next is discharges. So discharges एक ऐसी चीज़ होती है जिसमें you have to particularly see that everything in the file is updated, all the consents are taken, everything is done, and then you can fill the discharge card or the death certificate, whichever one you are filling, and you can hand it over to the patient. The file, which usually is kept with the hospital staff itself, the discharge card with the summary and everything is given to the particular relatives of the patient, so that you can use this discharge card and show it to any other hospital and they'll know the significant history. Now again, filling discharge cards, a lot of the interns do fill the discharge cards, but according to NMC, it is not a part of our guidelines. But every hospital you're going to find people doing the discharge cards because it's such a big part. Lastly, moving on to the 9th point, that is OPDs and managing patients. So whenever you're in the OPD, make sure that you are first of all on time, second of all you are wearing appropriate clothes, and third of all that you're having a mask, because all of these things are very essential. Mask, because you don't know in the OPD what sort of patients you're going to encounter, and you absolutely want to protect yourself from any airborne diseases, droplet ho, koi bhi ho, airborne ho, whatever, mask will definitely protect you. So always mask up during the OPD hours. Next, always be careful to evaluate the vitals of the patient, because vitals are going to give you a key insight as to what the patient is suffering from. That might be insidious, that might be very, very visible. So if somebody, an old lady comes to you with complaints of, let's say, burning micturition, you're suspecting a UTI, but you do a blood pressure and then you are like, okay, blood pressure is very, very high, it's like 200 by 120. So it could be a UTI which has gone ahead repeatedly, caused something like chronic kidney disease that's causing the hypertension. So there you go, you have already got something in your mind which was different from UTI. So always remember, vitals karna बहुत important hai, that you are all supposed to do. Take the history very, very carefully, examine the patient thoroughly. In OPDs you might not get the time, because I have personally done 100 plus patients wali OPD, 150 plus patients wali OPD. In fact, I have managed all these OPD individually, that means by my own. एक जगह पे एक टेबल लगा के मैं खुद इतने patients निकाला हूँ देख देख के. So that's the thing, कि you have to be confident in your own abilities and just give at least कुछ seconds of time to do some examination. You don't have to miss anything as a doctor. And even though OPDs can be hectic a bit, but those are the most learning, most growing opportunities and the most amazing things that you can do, because people come with your complaints and then you prescribe. 3 to 4 days later in the same OPD they'll come and they'll be like, okay, I'm good, this is, you told me to have a follow-up. Right, always. So pharmacology is very, very important, especially when you have to go to your OPD and write the prescriptions. You might not know the drugs, you might not know the doses. So there is this app called as Pharmeasy, right? So usse hum medicines order karte hain. Whatever the common medicines that you are going to prescribe, you can just look it up on the app and see the dose. And so, for example, Levocet, okay, that's a very common dose and a drug that we use in our day-to-day lives. So what is the dose? You don't know the dose. You can go to Pharmeasy and check, okay, 10 mg is the dose. Or maybe let's say amoxicillin caminic acid, 625 mg TDS, that's the dose. Metronidazole, 400 mg TDS. So that is the particular dose and the drug that you should be knowing. So Pharmeasy, one free application you can do, you can sign up. Another application is by actually Deepu Sebin sir. So he made it, I think, before he made Marrow. So it's called India Drug Index. So it shows you all the different drugs, their doses, and also the brand names with the cost. So it's a very wonderful application that people can have in their phones. Nobody is paying me anything to say about it. It's just that I have been genuinely using it since such a long time. So I just wanted to talk about it. You can also write different commonly used drugs with doses. You can also write commonly used drugs and doses inside your notes application so that you can refer at any point. And whenever you have certain doubts, please make sure to ask your seniors as to what to do next. In the OPD paper, you're also going to write the investigation. So make sure that always write the relevant investigation, faltu ki investigation mat karo, and always have your differentials in mind. That's how you're going to get to the investigation. For example, there's a man who comes to you, an old man, comes to you with, let's say, burning micturition. Okay, again, UTI ka case suspect kar rahe ho. But make sure that you also do an ultrasonography in that patient to see, and also you do a PR examination just to see if he has got any sort of prostate issue, which you can just rule out, or you can have it diagnosed, because old age mein sab cheezein common hoti hai. There's this book called as The Practical Prescriber by Ghanshyam Vaidya sir. So that book is a very good encompassation of all the things that you should be doing as a general practitioner, especially for people like me who were interns in the starting. So I read that book. It provided me with great insights. So again, that is something which I would recommend. So I guess that is quite a lot of things to talk about in this video. Next part 2 will be where I'll be showing you everything, how to do all the different procedures that we are suspected, right from intracats to intramuscular injections to intravenous injections to Foley's to Ral's tubes to many, many different things, because all these things are something that you should be knowing as interns, even as final year maybe students should be knowing. So thank you for watching this video. Make sure to stay for part 2 and do subscribe if you want to learn about all the different procedures that we are doing.